Okay, very happy to have Dr. Tess Lawrie here. Dr. Lawrie, you are somebody who I've been trying to get for a long time because you have quite a bit of background with the WHO. And everybody right now is talking about the World Health Organization and the pandemic treaty, I think is what it's often called, or the WHO Accord. And as somebody who was in legacy media for quite a while, whenever I see the fact checks come out, I wonder what's really going on, right? Because they always fact check people on social media, which I find to be the first fascinating phenomenon, because if it's just like some random, people out there who are just concerned about it, the media is like, we have to fact check this, but they often don't fact check each other or fact check the government or fact check, it's only fact checking like Joe Smith, who posted this on Facebook, which makes me wonder what is so concerning about what Joe Smith is posting about the WHO right now. And what people are posting is that they're concerned that essentially this agreement is going to basically empower the WHO to have control over, well, in this particular case, the United States, decision making when it comes to public health. So you used to work with WHO and you got a lot of background on this, so I wanted to talk about this first. Maybe give a quick background, and then could you tell me, do you think that people are rightly concerned about this, or is it just unfounded hysteria?
Thanks, Alison. Yeah, and it's very kind of you to invite me on your show. Well, I'm a medical doctor and researcher. I worked with the WHO as an external consultant for 10 years. And when COVID came along, I was concerned because the policies they were following were not evidence-based, and the whole world seemed to be following these policies, every country. And so I did my own research, certainly, and found that there were, in terms of COVID, there were safe, effective treatments that had been suppressed, withheld from the public, and of course that the injections were certainly not safe enough to be rolled out to human beings. There was not evidence sufficient from the animal studies. So all of those things pointed to me to the fact that we need to be gravely concerned about who's controlling the who at this time, because it would seem that it is being controlled by external forces, namely the World Economic Forum and Bill Gates and other influential people and organizations. So in terms of the so-called treaty or accord or instrument, there is reason to be concerned, but not necessarily in the way you think. The treaty is one of two documents that's being pushed through at the moment. The one is the amendments to the International Health Regulations from 2005, and the other is the Pandemic Treaty. Now, it's the health regulations that we really need to be focusing on right now. And the amendments to the International Health Regulations do not require your country government to sign or anything. It's literally just a simple majority vote taken in at the WHO, and it's a legally binding document. So the treaty at the moment it's on this dual track, but in some ways it's a distraction because it's the amendment to the International Health Regulations that carry such dire consequences for us as human beings, because in that document it mandates the necessity for a vaccine passport, which is being called a global health certificate. So it means that if that document goes through, we will all have to have a global health certificate in order to move, in order to travel anywhere. And with that then comes the mandates. So the mandates in terms of what you have to get this health certificate. So it dramatically changes our way of life, dramatically impacts our individual sovereignty. And the fact that this new, these amendments empower the WHO to mandate these things. So it changes WHO's status from being advisory to mandatory. And in so doing, it then elevates the WHO's health policy making over our country policy making. And so the WHO's constitution and decisions would supersede our country policies, no matter what country you're in.
Okay, looking at this article, the claim Biden gave World Health Organization full authority over U.S. pandemic policies, and they're rating false, essentially saying, here, the proposed accord is meant to encourage global cooperation in responding to a pandemic, which for them is great. I mean, why wouldn't you want to do that? When they say that it's just encourage, they use the word encourage. How does the WHO encourage countries? Does it take, what's the stick behind the scenes, I guess, that they're batting over the heads, or how do they encourage? Is that the right word to use, or is it?
No, they actually are able to enforce these mandates in your country. So the treaty and the regulations facilitate the announcement or pronouncement by the WHO Director General of there being a health emergency. So it doesn't have to be a real health emergency. It could be a potential health emergency. So the scope that is being the WHO's scope in this to declare a public emergency of international concern, any public emergency, and it could be actual or potential, is being facilitated by these documents. And then the WHO would be able to announce what treatment was necessary or what preventive measures, how they were to be manufactured, what determined whether they were safe, how people would be tested, quarantined, and what lockdown measures would be available. And they also, most importantly, both of these documents speak about censoring voices that misinform or disinform the public. So they both have language in them that allows the WHO to decide what health information we can have access to.
Mm-hmm. Okay, I want to ask you in a second about your thoughts on the media's coverage of this over the last couple of years. I mean, when I say this, mainly the authority of these global organizations to restrict behavior, and often I see it sort of I don't know, derided as an over. I don't know. It just, people are just overly hysterical about it. There's nothing wrong. They're just people working to do the best that they can to keep people safe, around the world. And listen, you'll still have your freedoms. And I think don't take seriously what in the alternative world a lot of folks have been talking about for a while. I don't know what would have to happen for the legacy press in our country to start going, I don't know, maybe we're overstepping people's rights. And that's something you're all are working on too with your new council. So we're going to talk about that in a second. Don't forget, everybody, though, if you want to support my work, you can get an amazing Malbec at a great price at AllisonWinePromo.com. I got to give my wine sponsor a shout out here because they help people like Dr. Lawrie come on my podcast, and they are pro free speech. So if you're already a wine drinker and you want some amazing Malbecs from Argentina, there's all high altitude Malbecs from very small remote regions, small family operations. One in the middle that you're looking at comes from a family vineyard that's over 200 years old. And another one uses natural fermentation. They handpick the grapes. Wines you can't get at the grocery store. And like I said, they're very high quality and you get them at a great price, 50% off the wine, 50% off shipping. And it's a wonderful way to support my work. Plus it's a great conversation piece. You can watch a video like the one you're watching right now and have a great wine that pairs with it. And then take a bottle, whatever you have left. Maybe you probably only have one glass left, but that's fine. You can take it over to your friend who you canceled 2 years ago because you couldn't stand their choices or what they were talking about with the pandemic, but you heard Dr. Lawrie say something and you're like, oh, maybe they were right. So I'll bring the wine over, say I'm sorry, and then you can talk about what you learned in the podcast. Okay, so thanks again for supporting my sponsor, AllisonWinePromo.com. Okay, so let's go back for a second. I'm going to pull that out. Let's go back to the topic of media and what you think of the coverage. Like, I know you could probably teach an entire year's course on this, but if you would say like one of the, or a few of the things that the media got very, very wrong related to the topic of global health collaboration and its encroachment on people's individual rights, what are some of the things you noticed were often overlooked, I guess, or minimized?
Well, there was outright censorship of early treatment. For example, ivermectin, the medicine that can't be named really on YouTube.
Yeah. And by the way, Dr. Lawrie, we are on YouTube right now, but we can cut the stream like in a few minutes on YouTube, and then you can talk about, I want to ask you about ivermectin, but yeah, let's cut the stream on YouTube. Oh, and I have to say this, not because we're trying to evade censorship on YouTube, just because we like the other platforms better, because YouTube doesn't like it when you cut the stream and go somewhere else because you want to talk freely. But anyway, yeah, save the hot stuff and we'll be finished on YouTube in a few minutes. But yes, that's one of the things you're right, you cannot talk about.
Yeah. So, you know, I think one has to, the legacy media has a lot to be accountable for. And it's not just a question of bias. I think what is most worrying is really what they know, not what they're biased over, but what they know and they haven't shared. So there will be individuals who have stories have crossed their desk and they've been told not to share it. And I think this is really, you know, the dire state that we're in with legacy media. It's basically a controlled propaganda machine. And, you know, the simple questions they haven't asked are it's not only around why was nobody allowed to treat COVID? Why were doctors not allowed to treat COVID? Why were doctors discredited for trying to treat COVID? Why were doctors discredited for raising concerns about the experimental injections that were just jabbed out and coerced or bribed or, you know, all sorts of means to get into people's arms? So lots of questions about that. But with regard to the World Health Organization, you know, people don't seem to realize it's majority funded by private money. So it's a really privately controlled organization. If you consider its budget pre-COVID was around $6 billion, only $1 billion of that is money that is that is spent on its normative work. The majority of that money, of around $5 billion, is voluntary contributions, and these voluntary contributions can be specified. So they're specified: you must spend this on vaccines, or you must spend this on PCR test development, or you must spend this on health system vaccine development, control, and whatnot. So it's like buying them. You know, it's like they're bought, and they've got pharmaceutical companies that support them. They receive money on that ticket. So that's the majority of their funding. So they're going as a public. Public health organization, but in actual fact, they serve private interests.
I never knew that about them. That's fascinating. And do you think the media, the average journalist, knows that? I didn't know that.
No, I don't think they do, but they're not asking the questions either.
Right.
You know, who is this? What is this organization?
Right.
How is it funded? Why does it seem to be speaking regularly with Bill Gates? And why is he and why are his representatives in meetings? Mm-hmm. And why is it his health policy when he says everybody needs a vaccine in their arm? Why do they recommend that? You know. Mm-hmm.
Very odd. You're right. It's not a concern for them. And I think I talk about this a lot. It's a concern for journalists when they're concerned. And so if they feel like they'll be okay with whatever the particular policy is, then I think they think it's not news. And they don't really care if a large amount of people across the world disagree or are negatively affected, because they just look at it like, well, sorry, you know, we're the parents, you're the kids. We just have to discipline you. We have to do what's right for you. And you may not like it, but I'm not going to give you sugar. That's kind of the way they look at it, I think.
Yeah, I think we need to all revise the way we think of authority, because we've forgotten that authority is supposed to serve us. We've employed them. We've employed our government officials, and they are supposed to serve us, not private corporations. And we need to empower ourselves. So many people say, oh, what can you do? I mean, it's a big organization up there in Geneva, and, you know, what can we do? They're just going to do what they do anyhow, and their controllers have got so much money, we can't. Well, we actually can, and it is our responsibility and our duty for our children to make sure they live in a safe and free world. And as long as we do not stand up and say, we must exit this corrupt organization. Our governments are paying our tax money to support this organization. We, each and every one of us, should be sounding the alarm and saying, we will not accept that. We do not want our money to go towards this corrupt organization that has caused enormous harm during COVID, if not before. And we demand that our governments exit the WHO and defund them. And if we defund them, well, then, you know, they certainly don't represent us, and they do not have our best interests at heart.
Fraser Bailey says, you can't really fact check the mainstream media because it contains no facts. I will say they do write often. They write these fact checks or say them in a way that it doesn't actually take the claims often seriously enough. What they debunk, in other words, isn't actually often what people are the most concerned about. So it's like, I read a lot of these fact checks and they don't actually fact check the real concerns that people have. So they leave it so vague and open that it is almost difficult sometimes to debate with them. And I don't really know, when I look at the way that they're written, I don't know, and it's hard to know intention, if the journalists are just totally unaware, which I think, honestly, in my experience, just especially being somebody who for a long time was just unaware of the depth of the nefarious, I think, powers that work with all this. But I think even some of the people who are doing the most evil sleep well at night thinking that they're doing something benevolent for the world, and that, you know, just people just don't understand them, that they're really trying to do good. I don't think they're sitting there saying, oh, I did so much evil today, I know the opposite. That's just my take on it. But
for many people, it's just a job, and they get paid for it. And many of those fact checkers are supported by foundations of some sort or other. And these foundations are set up by corporations. Corporations have, you know, foundations are part of their PR. In fact, it's part of their money-making approach as well. So they spend fortunes on PR. And if they're not getting what they like out there in media, they manipulate it via via foundation, their so-called philanthropic elements. So fact checkers, and here's a fact they can check. I would say that fact checkers are employed by corporations to control the narrative.
Oh, yes. Well, they have convinced themselves, though, that they're controlling the narrative for our best interest. And I think because there's an elitism about it, that we know better and you're better off with less information because you'll run roughshod over it like a toddler, basically. I really do think there's this intellectual elitism about how many people think through this. Dr. Lawrie, tell me about the World Council for Health and how this differs.
Okay. Well, if I could just say, my last point on the WHO is that what is being done through these documents is to manifest a one world government. So it's not just the WHO, an organization over there across the pond. It is actually a vehicle. It's a tool to manifest a one world government that controls the world. This is what is on the cards. So we need to think of how we can counter that very, very centralized approach and centralized aim, and that is putting the power. There's a cabal of people that seem to think that they know what's best for everybody in the world, and they want that power so they can control what we do, how we spend our money. They can actually profit from us and our data, and keep us in a cage. So we need a strategy that's different from that, and we need to realize there's a better way. We don't have to just accept it and go along with it and say, oh, things aren't the same as they used to be, or I can't do that, but I can do all this cool stuff on my phone. We actually have to create a better way. So we have established the World Council for Health. It's a grassroots organization. It's got over 190 partners internationally now, across 49 countries. And we are actively creating a better way, uniting people around 7 core principles. It's called the Better Way Charter, and it's 7 ways in how we move forward and create a better world together. It's simply, we act in honor and we do no harm. We're free beings with free will. We're part of nature, and we need a healthy planet to get by and thrive. We are spiritual, so we thrive when life has meaning and purpose. We thrive together, and we value our differences. We enjoy our conversations, and that's, a different perspectives is how we actually refine our learning and wisdom. And lastly, we use technology with discernment. Actually, there's a footnote too, and that says we do not tolerate the violation of our inalienable rights, which includes the right to travel, to speak freely, and our bodily autonomy. So World Council for Health is really facilitating the empowerment of health, freedom, and sovereignty. Because if we are not free, we are not healthy. And if we are not autonomous and able to make our own decisions regarding our health, then we're not healthy. So we're encouraging people to take responsibility for their health, and we're facilitating that.
Okay, and if people want to learn more or participate, what's the best way to do that?
Please visit our website, worldcouncilforhealth.org. There's a newsroom, and every Monday we live stream a meeting with various better way people like, really inspiring the way forward for food and farming, for healthy practices, sovereignty. And then we also have a Get Involved page, so you can print out the principles, share it in your neighborhood. There's a whole lot of different leaflets, because obviously there are many people who have taken the injections, for example, the COVID injections, and they're not feeling that great. So there's resources you can share with them on how to detox, and also how to find support groups that are helping. And other ways that you can actually get involved. So that is, that is what I would suggest as a starting point. As an advance from that is, if you're really interested in co-creating a better way, we have a Better Way conference in June. We've got some amazing speakers coming from around the world to Bath in the UK, and we had a Better Way conference last year, which was really amazing. We had Del Bigtree as the MC, 7 solutions focused panels, all very. It was very inspiring and motivational, and at the end of it, everybody left really feeling like, feeling engaged and wanting to help with this better way forward. So I hope that people will consider attending, or it'll be online as well. So do look out for an online ticket at betterwayconference.org.
Okay. We are going to cut the YouTube stream, but first, don't forget, if you want to go to AlisonMorrow.locals.com, you can become part of my editorial board. There are questions that I'm going to throw at Dr. Lawrie in a second, and it's a great way to support my work, but also be part of the news process. You get to go one-on-one with some of the most censored people on the internet. And Dr. Lawrie, I also have a question for you, too, that I'll have you answer once we get off YouTube, and that is, do people ever say, wait a second, you worked with the WHO for a long time. Weren't you part of this system? I mean, why all of a sudden are you criticizing it? This is a little weird. I don't know if I trust you. So I want you to answer that. If you're on YouTube, thanks for watching. Go over to Rumble, ROKFIN, or Locals.